Good afternoon, everyone. My name is Katherine.
I'm Hannah.
And I'm Nicole.
Today, our group will be discussing super resolution ultrasound imaging, or SRU for short. We are reviewing this topic because it introduces the capabilities of ultrasound beyond what we have learned. As we know, spatial resolution in ultrasound is limited by diffraction, but SRU surpasses these limits, thus leading to unprecedented spatial resolution. It is reported to be in association with the progression of kidney disease, atherosclerosis, and tumors. This is why the assessment of changes within microvasculature is significant in monitoring the development of pathology. The purpose of our review is to explain the technicalities of SRU and how the potential in microvasculature assessment is a key breakthrough in ultrasound. We want to give insight on how it can aid as a useful index for both diagnostics and prognostics for specific pathologies. Here we have a brief overview of the topics that we will be discussing today, starting with an introduction explaining what SRU consists of. Nicole will then be discussing the significance of microvasculature, and lastly, Hannah will be discussing the diagnostic purposes. SRU is an innovative new technology in its developing stages. Super resolution simply means improved spatial resolution. The key breakthrough in optical super resolution is that it's a form of imaging that goes beyond the acoustic diffraction limit. SRU combines several techniques which use high-frequency acoustic waves that can distinguish objects closer than the diffraction limit, which is approximately half of a wavelength. It's an advancement that was inspired by fluorescence localization and super resolution microscopy, or SRM for short. This is a method in which fluorescent molecules can be distinguished from one another using localization. Typically, when two particles are closer together than the diffraction limit, we are not able to distinguish the two and they appear blurry. The localization aspect consists of finding the centroid of each individual fluorescent molecule, which then creates the high-resolution image. SRU adapts these advancements by using contrast agents or microbubble tracking as seen in this figure to visualize smaller vessels. SRU combines both the advancements in fluorescence localization and SRM. With the use of contrast agents, SRU has the capability of distinguishing microvascular networks within the body. This has the potential to provide vascular imaging in the brain, as seen in figure 2, as well as the skin, kidneys, and lymph nodes. SRU is a revolutionary advancement in ultrasound imaging because it surpasses what we had known to be the limitations of ultrasound. In essence, these advancements will play a huge role in contributing to the progression of ultrasound in both diagnostic imaging as well as therapeutic techniques. Now, Nicole will discuss the significance of microvasculature.
Thank you, Catherine. Now I will be talking briefly about the microvasculature. So what is the microvasculature? The microvasculature is a system of micro blood vessels that include capillaries, arteries, and venues, which play a significant role in tissue perfusion. This is where exchanges of oxygen and nutrients occur between the blood vessels and organs. The human body's circulatory system consists of a vast network of vessels of varying sizes. There are approximately 40 billion capillaries in the adult human body, with the smallest vessel diameter being less than 10 micrometers. Why is the microvasculature significant? Early disease progression can develop in the microvasculature first, and this can be seen in conditions such as diabetes, arteriosclerosis, and cancer. It is also known that solid tumors tend to outgrow their host's blood supply and develop new blood vessels via angiogenesis. Research also shows that neurodegenerative diseases such as dementia, Alzheimer's, and Parkinson's all start at the microvascular level in the brain. Therefore, having the ability to detect pathological changes in the microvasculature will be useful for early detection of these diseases and allow for early treatment. And now Hannah will be discussing the diagnostic purposes.
Thank you, Nicole. SRU imaging is a promising diagnostic tool for diseases linked to vascular abnormalities such as cancer and chronic kidney disease. Malignant tumors are found to be associated with abnormal microvascular changes in size, density, and branching. Acoustic angiography is used to detect these abnormal microvascular features. However, this technique is limited by spatial resolution. In contrast, SRU imaging does not have spatial limitations, which allow for early detection of these abnormal microvascular changes with higher sensitivity and resolution. In a preclinical study conducted by Lin et al., they found that tumor-bearing tissues appeared more tortuous than normal tissues, suggesting tumor-related microvascular angiogenesis. Here on the upper panel, we see the normal tissues, and on the lower panel, we see the tumor-bearing tissues, which appear more tortuous. The results of this study show that SRU imaging was an effective tool in differentiating microvasculature in healthy tissues from tumor-bearing tissues. Furthermore, the high resolution of SRU imaging also allows for differentiating vascular phenotypes, as shown here. Clinical applications of SRU imaging on cancer has started, specifically for breast cancer. They found that a dense microvasculature network is a hallmark of malignant tumors. Furthermore, these microvasculature models obtained using SRU imaging can be used to obtain functional parameters such as relative blood volume, flow velocity, and direction. These functional parameters will allow for the diagnosis of malignant tumors and differentiating different tumor types. Next, I am going to talk about chronic kidney disease. Chronic kidney disease is characterized by degradation of renal perfusion and microvasculature. SRU imaging is capable of detecting microvascular changes, thus making it a promising diagnostic and monitoring tool for chronic kidney disease. Previous studies demonstrated that SRU imaging could detect renal microvessels as small as 1/3 wavelength, which allows for the assessment of changes in kidney morphology and vasculature, such as size, density. Human trials have also begun using SRU imaging. However, motion artifact has been deemed a major issue in SRU imaging of the kidneys. Human subjects are prone to motion artifacts due to their breathing compared to animal models. This issue needs to be addressed for future clinical translation of SRU imaging of the kidneys. And here's an image of the kidneys obtained using SRU imaging.
To conclude, SRU is a promising diagnostic tool for diseases linked to vascular abnormalities such as cancer and CKD. SRU allows for monitoring of these diseases in a non-invasive and cost-effective way. As Hannah mentioned earlier, various animal models have shown promising results. More human studies are needed in the future for the clinical translation of SRU imaging. Our review has shown that the potential of SRU imaging and its ability to assess the microvasculature. Many pathologies often start at the microvascular level before it becomes more obvious in larger vessels, seen in conditions such as diabetes, arteriosclerosis, and cancer. Our goal is to introduce this new technology in hopes that it can advance the ability of ultrasound and offer a new perspective of its capability. SRU can lead to innovations and allow for earlier detection and monitoring of pathologies. Healthcare is always changing and progressing, and we hope our review introduces innovations and excites our fellow sonographers.
Thank you for listening.
Thank you.